Hello, good evening. My name is Dr. Trudy Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to our clinic this Tuesday, the 20th day of September 2022. Now, today we're going to talk about a phenomenon which it's rare, but which can happen. So imagine yourself pregnant and expectant, and something strange begins to happen to your male partner. So imagine yourself for a second. It's possible you might have experienced this in your home. So today we're going to look at the phenomenon called sympathetic pregnancy among men, or what we call Couvade. This condition is possible among some men, depending on the proximity, depending on the communication, depending on a couple of factors between the partners. So Couvade syndrome or Couvade phenomenon or sympathetic pregnancy, it's the process, it's the phenomenon of having the male partner. So the male partner might be the husband, it might be the boyfriend, it might be the fiancé, developing symptoms mimicking pregnancy, pretty much the symptoms that a woman that is pregnant will be experiencing, will experience this in a man. This is a common condition among some men, and over time they discovered a pattern. So this will be the basis for my discussion this afternoon. So please, when you join, confirm you can hear me clearly, confirm you can see me clearly, and also let me know where you're located. My name is Dr. Chidi Ufundu. Every Tuesdays about this time, we normally come live. I apologize. I was supposed to come around 6:30, but I came back a little bit late. So after this clinic, we are also going to go to our Facebook, and we're going to try and understand this particular strange, rare phenomenon. You can call it rare, but it's relatively a newer concept. So imagine yourself in the excitement of pregnancy, of expecting a baby, which can be stressful. The state of pregnancy can be stressful. Pregnancy changes everything physically, mentally, psychologically, emotionally. You will not be the same. Everything about you is going to change. So imagine the changes, your planning, your preparations. Then suddenly, your partner begins to feel different. Your partner begins to feel kind of a sympathy symptom. You are vomiting, he's vomiting. You are having fatigue, he's having fatigue. You are having toothache, he's having toothache. Now, when this happens, about that time, you guys are expecting a baby. This might be a phenomenon we call Couvade syndrome. It's relatively common, but based on the fact that it's a newer phenomenon, we have not completely named it a medical condition. Now, what you're going to expect about this condition is actually derived from a French word which means to brood or to hatch. It was first noted in 1865. So think about that. It's been around since 1865. So it's not really new. It might be new to us, but it's something that has been happening there. So somehow they observed that in the past, when women are pregnant, their partners will mimic a couple of the pain during labor and when they are breastfeeding. So very close partners might, hang around and try and give comfort to their partner. And in course of doing this, we noticed a pattern. So it was based on this pattern, they now derived the syndrome. Now, thankfully, it's not yet classified as an official medical condition. So you won't go to the hospital and they say, oh, go home, you have Couvade, or you have sympathetic pregnancy symptom in men. But I just want to tell you that it's possible that whatever your partner is feeling right now might be related to the fact you are currently pregnant. So what do we know about the cause? This is one of those conditions in medical practice we don't really know the exact cause. So the cause is what? Unknown. So we don't know exactly what leads to this. But it looks like there are a couple of psychologically mediated factors that might be predisposing men to developing this. So what are the symptoms? What are those specific things that men, their female partners are pregnant can feel? Number one of the areas that pregnant women normally notice changes is what? In eating. So you develop a craving for a particular food, or you develop aversion for a particular food. So when your male partner, when you as a man, suddenly, when your partner is pregnant, you begin to crave the same thing she's craving. You begin to avoid the food that previously you used to like. Then it's possible you might be having the symptoms in tandem with Couvade or sympathetic pregnancy in men. So symptoms can be broken down into physical symptoms and psychological symptoms. So a man might develop anxiety. Pregnant women by default have a lot of anxiety. They worry a lot. Will the baby be okay? What's going to happen? I'm not hearing my baby's heartbeat. So any little thing will frighten you. Any little thing will make you to be anxious. So men that have sympathetic pregnancy symptoms can present with anxiety. Some men can present with depression. Some men can have problems with sleeping. Maybe they can have insomnia, or they might be sleeping too much, or their pattern is completely messed up, or they might have restlessness, or they might have decreased desire for sex or increased desire for sex. These are physiologic, psychological changes that men that might have this condition might have. Now, let's talk about the physical symptoms you might likely see in a man that have Couvade syndrome. You will notice that the man will be vomiting. The same time the pregnant woman is vomiting, the man is vomiting. The man is having nausea. So this is one of the classical presentations of pregnancy. So we normally call it morning sickness. The fact it's called morning sickness doesn't mean you have to only vomit in the morning. A pregnant woman can vomit anytime. So if you notice this in a man, if the man is having heartburn, pain or bloating in the abdomen, change in appetite, leg cramps, back pain, urinating frequently, weight gain, weight loss, stomach distension. If all these things are newer developments, when your partner, when your wife, when your fiancé was pregnant, it's possible there might be the physical symptoms of Couvade syndrome or sympathetic pregnancy symptoms in men. Now, the commoner presentation in pregnancy among women is toothache. So if your partner also develops toothache about this time, it's possible your partner might have this sympathetic pregnancy syndrome. So let me repeat again. Stomach distension. You notice that about that time your stomach is getting big. You notice you're gaining weight or you're losing weight. You notice you're urinating frequently. Now, the diagnostic criteria for this sympathetic pregnancy, you see all these symptoms I'm mentioning. When your partner goes to his primary care physician, they won't notice anything. No malaria, no infant. So the determining factor is that during this pregnancy, when your partner is developing this, when we go to the hospital, we cannot find a clear reason, a clear cause of what they are having. And if this symptom disappears the moment the baby comes, classical Couvade syndrome. So like I mentioned, there are so many strange things that happen in medical practice. There are so many things we don't know. This is still an evolving area of medical practice. But I just want to remind you today that if you notice that your partner is acting funny lately, he's feeling tired, he's gaining weight, he's complaining of this, he's complaining of that, within the time you guys are expecting a baby, it's possible your partner might be having sympathetic pregnancy symptoms or Couvade. So let's have that at the back of our mind. Now, what's the treatment of this condition? There is pretty much no specific treatment for this because remember, it has not been classified as a full medical problem. So there is no specific treatment for this. However, someone that can present with all these physical symptoms definitely will seek help. So if you're having pain, you take painkiller. If you notice you're gaining weight or you're losing more weight, you talk to your doctor. If you're having toothache, you see the dentist. So the treatment is based on what you're presenting with. But there is no standard medication that will say, oh, we're going to give it to a man that has Couvade or sympathetic pregnancy symptom. Okay, so this is a quick one. Ask your questions in real time. I'm also recognizing the presence of my wife in attendance. Babe, thank you and welcome. And COO, amazing COO is also in the clinic. And Tosi, thank you so much. So pretty much the three of you. Now the clinic is open. Please feel free to ask all your questions. Ask questions. We have about 15 minutes to play with. So I'm expecting at least 10 questions from each person. Okay. Can Couvade syndrome affect very close friends and very close relatives as well as the partner? Now, remember, right now we are still understudying this particular problem. So it has to do with the person that is actually intimate with the lady expecting the pregnancy. So we have not noticed an extension of these symptoms in the family. But remember, pregnancy changes everything. So if a woman is pregnant and in that family they already have kids, definitely that pregnancy is going to change the whole family, right? Let me tell you how. If your woman is having a very difficult pregnancy, she's vomiting all the time, she's not sleeping in the night, she's frequenting the hospital, it's going to change everybody's trajectory. It's going to change the stress level in the family. It's going to change the sleep pattern in the family. It's going to affect the kids. So pregnancy generally affects everybody in the family, but specific to this Couvade or sympathetic pregnancy in men, for now, is only limited to the partner of the woman expecting the baby. But very great question, babe. But right now, we don't really know if it's extended to the relatives. Okay? All right, guys, keep asking questions. Remember, we have a big event coming up on the 25th, our Multiple Pregnancy Summit. Multiple Pregnancy Summit. You do not want to miss this event. It's on the 25th. Registration is open now, so make sure you go and register for the event. Okay? Okay, here we go, COO. Are there risk factors or anything that can suggest that one is likely to have these issues? Now, this is what I know. You know, relationships differ, right? The closer you are to your partner, the more you're likely gonna feel her emotions. So if you guys are relatively very, very close, if you guys sleep on the same bed and you know definitely she's going to be having insomnia and you have empathy and you love each other, the possibility that couples that are very close will experience this is very, very high. If couples are wide apart, definitely the man will not even care if the pregnancy symptom is there. So expectedly, if couples are together, if they run through their whole thing, if the man is fully involved in the pregnancy, going for all appointments, staying up, helping, doing this, doing the chores, definitely that particular man that has a very good relationship with the wife will be at more risk of developing sympathetic pregnancy symptoms. So the answer is yes. Okay? Can Couvade occur in long distance relationship? Definitely. Remember the psychological symptoms, right? So all those restlessness, anxiety, depression, you know, there are so many times in pregnancy that you will be freaking out, right? Like if you have bleeding. Anytime there is bleeding in pregnancy, the pregnant woman is freaking out because remember one of the symptoms of threatened abortion is bleeding. So most women that are pregnant, once they are bleeding or they have pain or water is coming out of their body, they freak out. And if you're closer to your partner, assuming you're in America, your partner is in Nigeria, and your partner is not sleeping in the night, and your partner is afraid that she might lose the pregnancy, definitely psychologically it's going to affect you. So the answer is yes. So it can affect couples in long distance relationship because it's all about the bonding, it's all about the relationship, it's all about the communication. So the answer is yes. Okay? Beautiful question. Beautiful questions. Guys, keep asking questions, keep asking questions. If we don't have any more questions, then we probably gravitate to our Facebook and take care of Facebook. But this is a very important development. I'm sure some of you didn't know we have such phenomena. But there are so many things that happen in medical field that even me as a doctor, sometimes I begin to wonder what's going on. Okay? All right, Tosi, how are you? I hope you're ready for the upcoming summit. Okay. So let's see. Are there extreme cases where the patient also experienced labor? Now, remember, there is a big difference between this sympathetic pregnancy and delusional pregnancy. So there are actually some women that might not be pregnant. There are actually some men that might have mental health problems, and they will start experiencing virtually everything that their partner is experiencing. This is the power of the mind. So there is no exclusion when we talk about labor. So remember that pregnancy is not considered ended until we deliver the placenta. So the possibility that this might also extend to labor is very high. Because if the man is having cramp, he's having all those hormonal changes. And the funny thing is, sometimes our body follows our mind. So your body, like women that have pseudosciasis, that's, pretentious pregnancy, phantom pregnancy. You're not pregnant, but your body believes you're pregnant. It's a mental health problem. It conforms your whole hormones to start developing for your body to start reacting as if you're pregnant, but you're not pregnant. So this can also happen in extreme cases. So when the woman is in labor, the man will discover that he's actually also cramping, but it might not be to the same level the lady will be cramping. So the possibility of having this to the extreme of going into labor is there. I love this question. Very, very technical and very difficult. But please keep asking questions. Keep asking questions. And especially if your questions are not related to this topic, it's still okay. You're welcome to ask all your questions, okay? I know it's a very strange topic, but we learn every day. I'm sure you will tell your partner when you go back today that Dr. Chidi talked about sympathetic pregnancy in men. Okay? All right, let's see. Tosin, do you have any question? I hope you're getting ready for Sunday. We are ready. If you're hearing my voice now and you're not registered for that event, you are gonna miss a lot. This might be your opportunity to have your twins. This might be your opportunity to have your triplets. This might be your opportunity to have quadruplets. It's achievable. It's possible. So if you have been having infertility for a long time and you're on the verge of giving up, God can give you 2 next year. God can give you 3 next year. God can give you 4 next year. Why don't you come? Let's fellowship. Let's see what we can learn together and help you, okay? All right, so what we're going to do is this. Since we have relatively fewer questions for today's clinic, we are going to round up the clinic at 20th minute mark instead of 30th minute mark because we don't really have much questions coming up. It's more of an abstract topic. But let's see. Is it likely Couvade can occur as a result of stress from long-term BFB? The answer is yes. You see, when you desire something so badly and it takes time, when it comes, it can come with a lot of anxiety. So yes, the possibility that looking for a baby for a long time, which in our category we call it believing for babies, we don't try, we believe. So if you have been believing God for babies, for example, if a couple have been together for 20 years and in that 20 years they've been running around looking for babies all over the place, then suddenly the woman becomes pregnant. A good man, a good father to be will be restless, expectedly, because that baby is so precious. Any little thing you're freaking out. So we've experienced a lot of this in our community, right? We've seen partners that know much better than the women. You know about Chukuma, you know about a couple of few men. You remember one chike? Remember one chike that, when he came in, the lady didn't know nothing. They were expecting twins. The lady practically know nothing. But because they've had series of miscarriages, the chike knows every single 100% of that pregnancy until they had their baby and disappeared into the population like other people. So the answer is yes. The longer you stay before you become pregnant, when that pregnancy eventually comes, the possibility you might have anxiety disorder, the possibility you might have a lot of stress disorder is very high, especially if there are telltale complications in that pregnancy. The possibility that Couvade or sympathetic pregnancy in men might happen in this man is very, very high. Okay? Tosi, you don't have a question, strange topic for you. I hope you're learning. Okay, it's possible. There are so many strange balls in medical practice. All right, guys, let's round up and quickly get to our Facebook, talk to our community. Hopefully, we have more questions there. But babe, thank you so much for coming this evening. Maybe one of these, Tuesdays or Saturdays, you can come as a guest, presenter and give your own inputs. I know you don't have time, but thank you for coming this evening. We truly appreciate you. COO Kene, you rock. Thank you so much. Tosi, we're going to give you an award. COO, you're going to prepare a special award for Tosi. She's doing an amazing job. So guys, I will see you guys in Facebook right about now. Thank you so much for coming. And can I please remind me to post my transcript after this clinic? Thank you so much. Please, let's meet in Facebook. Thank you guys, and God bless you, and bye-bye.